Good morning, everyone. I'm Deidre Bell, Project Support Specialist with the Virginia Community Healthcare Association. Thank you for joining us today for the third session in our Emergency Preparedness Training Series, Telehealth. Our facilitators today from Strategic Solutions are Jay Strickland and Megan Papeo. At the conclusion of today's webinar, you will receive a link to complete a brief survey. Please take a moment to complete it as it provides us information to provide future programming to you. Without further ado, I turn it over to Jay and Megan. Thank you, Jay and Megan.
Good morning. Thank you, Deidre. Appreciate that. We're excited. This is the third webinar in this series, and excited to talk to you guys a little bit about telehealth today. So we'll go ahead and get started here. We put together an agenda for today to kind of cover what we'll be talking about. We'd like to do some introductions. Nice thing is we have a little bit smaller group here on the call today, so maybe we can be a little bit more interactive. And then we want to talk a little bit about what telehealth is, why a provider might be interested in moving forward with telehealth, how you go about that, and finally some resources to assist your practice or your patients in getting engaged in telehealth. So I brought back the concept of these little gold stars that we'll have throughout the presentation to kind of highlight some resources that might be more valuable to you. But again, just like on the previous webinars, don't feel like you need to take notes. We're going to make sure that we package all the relevant points up into an email that follows up with you afterwards, including a list of all these resources with links to the websites. Encourage you guys to share thoughts as well as we're going through this. Some of this may be a little bit basic for some of you, but if nothing else, it gives us a nice basis for some terminology and making sure that we're all on the same page and probably some good discussion points. So I'll dive right in. Anybody remember this TV show? You're probably dating yourselves a little bit if you do. It's celebrated its 50-year anniversary, but if you recall the TV show, this is probably the first introduction that a lot of us had to the concept of telehealth. If you remember Johnny on scene at a serious illness or accident or something like that would call back into Dr. Brackett at Rampart Hospital and get orders to be able to better treat a patient. So I think it's not a brand new concept. It's been around certainly for a long time. Things haven't changed. A lot of the same things happen today on the scene of an emergency, maybe a cell phone instead of a box-based radio, but I think the concepts are still very similar. So HRSA defines the concept of telehealth pretty clearly. A lot of words here, but I think the things to focus in on, and the thing that catches my eye is that it's not just about the healthcare aspect of it that we typically think about, but also education and even public health administration. So the definition from HRSA is a little bit broader than I think your mind typically goes to right off the bat when you think of telehealth. But they also go further to define some technologies, and again, I think the technologies go beyond what I think most of us typically think about video conferencing, but of course, regular phone-based audio and even text messaging can be considered in telehealth as well. It sounds like you guys all have some form of implementation of telehealth already, so you're probably using some of these modes. But just to review those real quickly, certainly the synchronous, this type of interaction that we're having today on this video conference is real time and interactive, and I think that's probably the thing that most people think of when they consider telehealth. But in addition, there's certainly asynchronous modes of telehealth, where potentially a patient is taking a picture of a rash and sending it to a dermatologist, or maybe a patient calls in and leaves a voicemail asking for a prescription refill, or even teleradiology is a branch of telehealth, where radiologist is reading image at a separate time. And remote monitoring of patients is coming on very strong and moving more quickly. So the ability for a physician to see the daily weigh-ins that a patient does on their smart scale at their home, or internet-enabled blood pressure cuff, or even something like a Holter monitor that has Bluetooth technologies that allows a patient's 12-lead information to go to a physician on a regular basis periodically. So as we think about those three different types of patient interaction, and then multiply that by three different technologies, and then multiply that by three different modes of interaction with patients, there's a lot to consider. So why? What is it that patients want to see out of telehealth? There's a study that J.D. Powers did just pre-pandemic and just post-pandemic, and wanted to share those results with you. These are the top 12 reasons that patients choose to or are interested in telehealth. And there's some things that kind of jumped out at me here. I don't know if you guys see this or not, but just highlight a few things in particular. The convenience from a patient standpoint is at the top of the list, and it was in both surveys. But if you look at the 2019 survey pre-pandemic, it was at the top of the list with 64%, but that dropped to only 51% after the pandemic started. And the reason was because some of that percentage got stolen down here to patient safety. Where safety was bottom of the list pre-pandemic, it jumps up to 46% in the top of the list. Not all that surprising, but kind of interesting, and it kind of gives you an idea of the impact that we have on our patients when we're deploying the telehealth. And it also kind of brings it back into our theme for this webinar series around emergency planning. So if you recall, if you were on the call a month ago, we talked about the four components of emergency planning, and how and so today we're talking a little bit about telehealth as a piece of that plan, and how telehealth can help with that. In particular, we start off that emergency planning process with the hazard vulnerability assessment. We talked about that a fair amount a month ago, and historically, and not even that long ago, but just pre-pandemic, a lot of these hazard vulnerability assessments always kind of rated some of the natural disasters and man-made disasters as at the top of the list for most likely to occur. And I think when we were planning, when we were going through the planning process, most of our focus was on those things. And in our lifetimes, we had never really seen a pandemic to speak of. So this communicable disease or public health emergency was on the hazard vulnerability assessment, but usually pretty low, and really didn't get the attention it was due. But obviously things changed as we went through this unprecedented event. And unfortunately, it's not over at this point. I traveled last week, and it was great to be on a plane and hear the announcement that you didn't have to necessarily wear a mask. But things are ramping back up. In particular, this stealth version of Omicron is kind of sweeping through the state. This is a current CDC map showing the transmissibility in Virginia, and we're ramping back up. It seems like, unfortunately. So it's a marathon, not a sprint. We're gonna have to continue planning and figuring out how telehealth helps us take care of patients in this state. So to talk a little bit about how some of the tools that you can use for deploying telehealth. So within the context of the public health emergency, if there's any silver lining at all, it's that that with that public health emergency declaration that happened beginning of 2020, there was a loosening of things. In fact, the public health emergency that continues to be renewed as recently as April 16th for the next 90 days is likely to continue through the end of the year. But with that brings enforcement discretion. The Office of Civil Rights, as you guys probably all know, has loosened the requirements, or at least backed down their focus on enforcing some of the aspects of the tools that you can use for telehealth. So in particular, the HHS identified some tools that weren't typically thought of as primarily used for telehealth, but that they're identifying as organizations that represent these as being HIPAA compliant in some fashion, and that there are organizations also that are willing to, more importantly, sign a business associate agreement. So, listening to what you all mentioned, it sounds like I heard a mention of Cisco. So, WebEx may be one that's in place, but really this changed things for a lot of organizations. Organizations that had challenges with the cost and the complexity of implementing telehealth were able to kind of dive in with some less expensive, easier to implement tools. And we also spent some time looking at a report that came out of Software Advice, which is another company that's similar to Gartner, that looks at a lot of different technologies. This chart represents the usability and the customer satisfaction of different tools that are used in the telehealth environment. I heard a bunch of you guys mention Luma, and we've also seen big uptick in adoption of DoxyMe and UpDocs as well. I know a bunch of you guys use eClinicalWorks for your EHR, and unfortunately the Helo application with eClinicalWorks kind of falls down on the bottom left of this chart, but it is a tool that's available to you all, I'm sure. I thought I'd let Megan mention a couple of things about two tools that we put together. So Megan, do you want to just talk a little bit about this?
Yeah, absolutely. So what we're looking at right now is a vendor comparison. We started this back during the pandemic as a resource to reference what each available tool can do and what it can't do. What HIPAA compliant features do they offer? What training do they offer? What integration to EHR do they offer? Integration to your calendar? We just wanted to look at everything that was sort of out there. During the pandemic, the market was flooded with options, especially once the HIPAA regulations were semi-eased. And we wanted to have a resource all in one glance that sort of answer questions that you might have about this. We're happy to send it out if you think it'd be helpful. And then the other document we have is sort of focusing on the codes and regulations and things for billing telehealth encounters via Medicaid and Medicare. Luckily in Virginia, there's a lot of parity laws that allow us to bill private insurance, but Medicaid, as we know, has a lot of restrictions, regulations, and really specific things. So we have a little guide on that as well that we're happy to send out.
Thank you, Megan. So, if you have interest in either of those, just reach out to me or to Megan, and we'll get you that as well. So, I want to spend a little bit of time talking, or probably the majority of the time, talking about some resources that are available to you all. That seems to be, in the surveys that we've seen for some of the other webinars that we've done, focusing on resources seem to be the most interesting thing to you all. And so we wanted to share some of the things that we've come across in looking at telehealth. Unfortunately, the HRSA grants that are out there, the majority of them have had applications close out for those. So while some of these grants are ongoing and continuing to support and fund telehealth efforts, from our analysis, it looks like most of these are closed out. But I would definitely encourage all of you to keep a close eye on HRSA's website and look out for programs either opening back up or new ones becoming available. But on a more positive note, some of the resources that are very helpful, certainly at the national level, the Telehealth Resource Center is a great resource. There's a ton of information on their website that could help all of you as you're working on this or expanding your programs. I just wanted to highlight one event that they have coming up here on May 27th. It's basic telehealth 101. It's maybe information that's more basic than some of you all need, but if you check out their website, they have a high degree of focus on the underserved market and specifically federally qualified health centers. So there's a lot of recorded webinars and future events coming up as well. And then more locally, our regional Mid-Atlantic Telehealth Resource Center is a great resource. And we're fortunate to be joined by Anita Browning from the Mid-Atlantic Telehealth Resource Center. So, I found that they've got a great deal of information about best practices, and more specifically, Federal Qualified Health Center targeted information about how to deploy telehealth. So I thought I'd ask Anita if she wouldn't mind introducing herself and talking a little bit about what they do.
Hi, thank you, Jay. I am Anita Browning, again with Mid-Atlantic Telehealth Resource Center, which we call Matrix, and I am also HRSA funded, and our mission of our grant is to provide assistance to facilitate telehealth, whether it be for emergency preparedness or for behavioral health or whatever the case may be, to provide assistance and then facilitate that. So we definitely have a number of resources that Jay has enumerated, and I have there are a number of things on our website. There was one thing I had even that's coming up that I hadn't even mentioned to Jay, which is in collaboration with the National Association of Community Health Centers, we have put together webinars that are specifically focused for telehealth for FQHCs. And I think they're going to be up within the next 20 to 30 days, if they're not already there. I edited them, and that's the last I remember. You're welcome to contact me. You're welcome to contact the website and look at the resources on the website, and just let us know if there's anything we can do as you move forward with telehealth, both with emergency preparedness, but then in other aspects. Thank you, Jay.
Yeah, thank you, Anita. Any questions for Anita? And we'll probably have a question and answer session a little bit later on, but thank you so much for introducing yourself.
Certainly.
All right, so a couple of other resources that might be valuable to you all. These are really more on the patient side, I know in one of the emails that we got before the webinar that there was an interest specifically in programs that might support broadband access. So the FCC has two programs along those lines. One is called Lifeline, and the other was the Emergency Broadband Benefit. And both of these are needs-based programs. They have a number of criteria they look at, but if you're in SNAP, Medicaid, or other CMS-funded programs, you can pretty easily get approved for this. And the programs either offer discounts or even potentially reimbursements for your broadband access costs as a patient. So, so it may be information that you could share with your patient base that is struggling to get access to be able to consume telehealth resources. But and there's a website that a patient can go to and really quickly get approved for this assistance. On a broader scale, there's the Virginia Telecommunications Initiative, which really looks at community broadband needs. So a public organization like a town or a county can request this, oftentimes in conjunction with a private organization like a FQHC, and it's run by the it's run by the Virginia Department of Housing, and it's referred to as the VATI, or Virginia Telecommunications Initiative. But this allows this provides infrastructure support and reduction of construction costs for the community, or in some cases for the potential patient to be able to get broadband delivered into their community. There are some and here's an indication of some of the areas that have gotten the benefits of that program over the last few years. And there's some specific dates for that if your community would be interested in that are coming up. There's a new program cycle for 2023 that is getting ramped up now. So you have to provide a notice of application and then create an actual application. The notice of application is July 7th, and the application is actually due August 25th. But here's a list of all the timelines, and in particular, the final guidelines are being released tomorrow for this program. If you think your community has this kind of a need, then you can research this and get more information about the program. But it is coming up very soon. So just to kind of recap some of the resources that we're talking about here today, certainly the National Consortium for Telehealth Resources, our local Mid-Atlantic telehealth resources that Anita's from, that's based out of UVA, and I think Anita's actually even here in Richmond. So I think I mentioned this on a previous call, but there are two governmental programs that relate to being able to provide priority telephone access to healthcare providers, or really to anybody who has a role in disaster recovery. There's a wireless priority system and then a landline priority system, but it's relatively easy to apply. Our organization applied so that we can help support you all and our client base in the event of any kind of a disaster, and it just allows you to kind of cut through a overloaded phone system to make priority calls. So if you have an interest in that, reach out to us and we can get you more information about how to get enrolled in that system. No cost at all. It's a Department of Homeland Security program that's fully funded, and they're actually kind of looking for more organizations to be a part of it. I mentioned the FCC Lifeline and the FCC Emergency Broadband program, and we'll also provide you with a frequently asked questions document around some of these programs. Virginia Telecommunications Initiative, or VATI, and of course your Virginia Community Healthcare Association sponsors this webinar series, is available to you as a resource, as well as our organization. So please reach out if we can do anything to help at all. So questions. We're going to open it up to see if anybody has any questions, either via chat or just unmute yourself and speak up. All right.
Jay?
Yeah.
I was checking to see if the videos are up yet. Yes, the videos specific to FQHC and telehealth is now up on the consortium, the National Consortium of Telehealth Resource Center website. You can just search under contact, under search, you can just look for FQHC and they're all up there.